Hi, my name is Anthony Lupo, and today I'm going to talk to you about hypothyroid disease. What is hypothyroid disease? Hypothyroid disease is an endocrinology disease that is caused by insufficient thyroid hormone production by the thyroid gland. The thyroid hormone is one of the major hormones, along with human growth hormone, or HGH, that affects many growth and cellular developments within the body. The most common pathologic hormone deficiency is hypothyroid disease, and there are two major mechanisms by which it occurs. The primary mechanism by which it occurs is a reduction of thyroid hormone synthesis and secretion within the body. This occurs when the thyroid itself or supporting endocrine organs stop functioning. The secondary mechanism by which hypothyroid occurs is a reduction in the thyroid hormone actions at the peripheral tissues. In this case, thyroid production is up, but the body is incapable of using it properly. The prevalence of hypothyroidism in the world is greatly contributed to iodine deficiency in the diet. In the U.S. and other developed countries where iodine is present in the diet, hypothyroidism is more often caused by the autoimmune thyroid disease such as Hashimoto's thyroiditis or medications used to treat hyperthyroidism. Hashimoto's thyroiditis is an autoimmune thyroid disease which occurs when the body creates antibodies to attack thyroid hormones and the thyroid itself. There are two types of hypothyroid disease: Hashimoto's thyroiditis, which is the most common and an autoimmune disease, and congenital hypothyroidism. Hashimoto's thyroiditis is a hypothyroidism found in 4.6% of the United States population. It is more prevalent in females and males and more prevalent in whites and Mexican American populations as compared to their African American counterpart populations. The risk of hyperthyroidism from Hashimoto's thyroiditis tends to increase with age. Congenital hypothyroidism occurs in 1 in 4,000 cases in infants in the U.S. It is typically due to a reduction or a reduced amount of iodine in the diet. It is present at birth and causes many congenital problems and growth problems within the baby itself. Death from hypothyroidism is uncommon. It is uncommon due to the ability to counteract it through iodine supplementation and thyroid hormone therapy. There are 3 organs involved in thyroid hormone production. Thyroid hormone production starts at the hypothalamus. The hypothalamus secretes thyroid-releasing hormone, which acts upon the pituitary gland. The pituitary gland then produces thyroid-stimulating hormone, or TSH. TSH is then circulated in the bloodstream until it gets to the thyroid gland. Once TSH arrives at the thyroid gland, it then stimulates it to produce small amounts of triiodothyronine, or T3, and thyroxine, or T4. T4 is converted at the peripheral level of the body into T3. Increased levels of T4 cause the pituitary gland to stop secreting TSH in a negative feedback loop fashion, and decreased levels causes the pituitary gland to increase thyroid-stimulating secretion. Hypothyroidism can have many detrimental effects upon the body. It can have decreased heart contractibility, decreased cardiac output, decreased heart rates, cardiac enlargement. There can be increased intestinal transit time for food and gastric stasis, delayed puberty, menstrual irregularities, infertility, and anovulation. It can also have an increase in LDL cholesterol and total cholesterol while lowering HDL and increasing insulin sensitivity. Hypothyroidism can initially be very hard to diagnose. This is because hypothyroidism tends to have symptoms that are common to other problems. However, the more severe the thyroidism is, the more prevalent the signs and symptoms appear. Some signs and symptoms of hypothyroidism include reduced basal metabolic rate, intolerance to cold, weight gain, easily fatigued, bradycardia, slow movement time and slow reaction time, slow mental responsiveness, pitting, edema of the lower extremities, goiter, loss of hair, and abdominal distension. The picture here displays a very prominent goiter. A goiter is due to enlargement of the thyroid gland, and it swells up, and you see this large bulge that appears in the throat, right located where the thyroid gland is. The only way to diagnose hypothyroidism and its cause is through blood hormone samples. The autoimmune disease, Hashimoto's thyroiditis, can be diagnosed through the presence of anti-TPO antibodies in the blood. Anti-TPO are thyroid peroxidase. If the hypothyroidism is due to thyroid destruction, there will be no thyroid function found in the blood sample. If hypothyroidism is due to pituitary and hypothalamic problems, there will be decreased levels of T3 and T4 in the bloodstream. If it is due to pituitary injury, there will be increased levels of TSH in the bloodstream. And if the hypothyroidism's main cause is medications, such as those to treat hyperthyroidism, there will be a decreased thyroid function and low levels of thyroid hormone found in the bloodstream. The effect of hypothyroidism on exercise response. Many patients with hypothyroid disease may develop an intolerance to exercise. They may exhibit early fatigue during aerobic and isometric and kinetic exercises, and due to the decreased heart rate and decreased basal metabolic rate from hypothyroidism, the patient may experience decreased heart rate with increase in exercise intensity. High-intensity exercise is not recommended due to high prevalence of decreased motor skill abilities. In severe cases, exercise may not be allowed at all. There are only two ways to treat hypothyroidism and manage it. The first is through an exogenous thyroid hormone. What this is a thyroid hormone supplement is given by and administered by the doctor, either as an oral supplement or as a direct shot into the bloodstream. What happens then is it increases the thyroid production and the output of thyroid hormones. The other way to treat it, in cases where it is due to the diet and low levels of iodine, by adequately supplementing iodine into the diet, you can see a severe decrease in hypothyroidism. Signs and symptoms of overtreatment of hypothyroidism are tachycardia, palpitations, nervousness, tiredness, headache, increased excitability, inability to sleep, tremors, and possible angina. Benefits from exogenous thyroid hormone and iodine level supplementation can be experienced as little as 3 to 5 days and typically level off within 4 to 6 weeks. So now we have our case study. Our case study today, our patient is Miss M. She is a 45-year-old woman with a history of prediabetes and metabolic syndrome. Recently, she has complained of being tired all the time, has had difficulty concentrating for any length of time, and has been putting on an increased rate of body fat. She went to her doctor recently and got blood taken. When her labs came back, there was a presence of anti-TPO or thyroid peroxidase in her blood. Her doctor also found that she has increased levels of LDL and her blood pressure was 125 over 105. Her doctor prescribed a regimen of exogenous thyroid hormone supplementation, which is to begin this week. She wants to lose the weight that she put on and would like an exercise prescription written for her. When treating someone with hypothyroidism, there are a couple of special considerations. Thyroid supplementation has been shown to increase heart rate and metabolism, so Miss M's heart rate should be monitored at all times whenever she is exercising. Any dizziness or lightheadedness during exercise should result in immediate stopping of any of the exercise at hand. Due to a systemic increase in salt retention, Miss M has reduced sweating, which should also be monitored to prevent the risk of overheating. Exercise testing is not necessary for Miss M, as she is currently on her thyroid hormone replacement therapy. Due to the swings and influxes of heart rate and blood pressure, that can occur while her body acclimates to the therapy. It is recommended that she does not do anything that can spike her heart rate to unsafe levels. For an exercise prescription, there are a couple of things that we should notice here. First, due to the decrease in exercise intolerance from the hypothyroidism and also the tiredness and confusion that can come with hypothyroidism, we should start off Miss M with short bouts of exercise, about 10 to 20 minutes. She should perform these at a frequency of 2 to 3 times a day for 5 to 7 days a week. The more she can perform it, the better she will get at it, and the more energy she will get. We should start off with an intensity of low to moderate. Due to her heart rate being increased from the hypothyroid hormone replacement, her heart rate should be closely monitored and kept at 50% of max heart rate or lower until the hormone replacement has finished and the patient's physician says it's okay. Once her physician says it's okay, it is okay to increase the intensity as long as she does not display any signs or symptoms of fatigue or weakness. The type of exercises that we should have Miss M perform are aerobic exercises such as walking and cycling. These are low impact exercises that can also keep her heart rate at a steady level. Strength activities should be kept at low intensity with low weights, especially while she is starting the hormone replacement, and it should have an increased number of reps, such as 15 to 20 reps per exercise per set. In conclusion, hypothyroidism affects many people worldwide and greatly lowers their quality of life. Many people with hypothyroid disease develop symptoms of depression, anxiety, and fatigue with increased weight gain. A proper treatment plan with consistent exercise program has shown to have increased levels of happiness, better quality of life, and decreased morbidity.